Welcome, everyone, to the Feminine Outliers podcast, your dose of fun, life advice, and experiences from two African professional women living and working in the Western world. We are your hosts, Cholwe Mandona
and Zelda Wasao.
And we are excited to have you here. So, today's episode is going to be different from the other episodes we have been doing. We are launching a career series, which is very exciting for the both of us because, as you have listened to our introduction, we consider ourselves as professional women. And Zell is a medical doctor, and myself, I am a civil engineer specializing in water. So we thought it would be great and hopefully valuable to our listeners to learn more about what we do on a professional level and to provide tips, advice, especially if you are trying to get into these fields of medicine and engineering, or maybe you're already an engineer or a medical doctor and you just want to connect and relate to the experiences that we have at the moment or that we have had as we have pursued our careers. So, to start us off, this episode will be Zelda, or should I say Dr. Zelda. We'll be talking about what doctors are not. And I am excited to learn from her because I have my own idea, or ideas rather, about what doctors are. Because when I go to the doctor's office, there is, I don't know, just things that come up in my mind and expectations I have about doctors. And I'm sure you have the same experiences. So we have a physician here to tell us the real truth. So, Dr. Zelda, what are doctors not?
I find it so funny when you call me Dr. Zelda. This is so hilarious.
I know. It actually feels weird because I always just call you Zell. And
right? So that's why you're saying Dr. Zelda, I'm just like that's funny. But yeah, I'm hoping that this series is going to be helpful. Hopefully for those of you out there who are curious about, what doctors are or are not. I mean, this might be triggering to some, just warning, but I'm just being real and raw with what I'm going to say. And hopefully it actually helps people when it comes to their future doctor visits, because I think this is important. So I have a couple of things that I'm going to say what doctors are not. And it's such a popular topic to talk about in the sense that there's a lot of different, TikToks stuff out there about it, at least within the medicine community, because I guess we know what we experience on a daily. So I'm going to start with a kind of obvious one. And my first one would be doctors are not responsible for your health. I feel like there's some patients who come in and one, if you don't care about your health and you don't care about, like, if you don't know, for example, what medications you're on, fine, you might be on a lot of different medications. But if you don't know them, and then I hate it when I ask a patient, like, what's your medication list? Do you have a list with you? And they're like, it's in the system. It should be there. You guys should know it already. And they just like assume and they say it with that attitude, like, why don't you have my medication list? And a lot of times it's not that we don't have the list, but hey,
Mm,
something could have changed between the last time the list was in and now. And so if something changes and there might be a medication that's on the list that shouldn't be on the list, or it might be a different dose, um, you might be getting it more frequently, or they might have removed something off the list or added something. I need to know so I can give you the right medications. But if you yourself as the patient doesn't care, then that's on
mm,
you. Like patients, they when they give that attitude, I usually look at the patients and tell them, you do realize that this is for you. This is not for me. This is
mm,
for you. So if you don't work with me, you're the one who ends up suffering at the end of the day, not me. Because
mm,
if I end up accidentally putting in the wrong medication because all I have in the system is what I have in the system, and sometimes the system is not caught up with what's actually real life
mm,
for one reason or the other, particularly if there are different medical systems involved. That's your problem, ends up being your problem. And I don't think that people realize it because ultimately you're coming to the physician for help for your health. We
mm,
will do our part and we'll do our best to help you out. But you have to take care of yourself. Like you have to be responsible for your own health. So part of being responsible for your own health is one, knowing what medications you're on. And two, if you don't know them, have a list of them. This particularly goes for elderly people. Have a list of them because it's your medication, it's your life, it's your body. Because if a physician messes it up because there's something wrong with the system, ultimately you're the one who's going to suffer if you're given the wrong medication. So, and I usually tell people, my patients, this because if you start giving me attitude because of that, I'll tell them, ultimately speaking, you're the one who's going to suffer. It's not me,
mm,
it's you.
mm,
So start working. So I know sometimes they get irritated because they get asked so many times, like in the emergency department by the nurse what the medication list is. They probably get asked by the emergency physician. Then when they get moved to their rooms, they get asked by the nurse who's taking over. Then they get asked by the admitting physician. And I know it gets irritating, but like you'd rather have multiple people check than someone miss something and then it ends up becoming an issue down the line that you have to suffer for. In the same
mm,
way, I mean, if you don't really put in the work for your own health, a lot of times people come to physician to patch them up and be like, "Oh, take care of me,"
mhm,
um, or take care of like basically they want us to resolve the issues that they have created. And yeah, that true. As physicians, we will treat you and we will take care of whatever problems you have. But then you're the one who's ultimately responsible for everything. We'll give you the medications and stuff to do. But if you don't make the changes on your end, or if you don't take the medications yourself, I mean, ultimately, it's going to be you who's suffering because it's your health, it's your body. So
mm,
if you come in and you're not taking care of yourself and you end up having to get your legs amputated, well, that was on you. Particularly if it's something that you should have, it's been going on for years.
mm,
Why didn't you take care of it earlier? It's your it's your responsibility. And sometimes patients they don't realize this. Like you kind of get this whole sense of they don't care or they're trying to blame the physician, and it's like no, 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 no.
mm,
Like you have to realize you have to do your part for your health. The physician can treat you up to a certain point, and then they will tell you, please take this medication, do this, do that.
mhm,
It's up to you if you actually follow that and actually do what's best for you.
mm.
Yeah.
Wow, that is fact. I'm just thinking about my experience going to the doctor, especially in the past. As you
Hmm.
said it, that idea of going into the doctor's office saying, take care of me. And when I used to go to the hospital in the past, it was because of symptoms that I was experiencing right away. And
Hmm.
going to the hospital, even before seeing the doctor, because typically the first person that I would be in touch with is the nurse. And shout out to all the nurses, because the nurses, at least the ones that I have had experienced, are really sweet and kind, and they just, I don't know, they approach you, at least for me, my experience is that uh, very lovingly. And so there's just, they set up
Mm.
this atmosphere of, oh, it's going to be okay, and let's just wait and see what the doctor says. Or they'll be like, oh honey, you're not feeling well, oh I'm so sorry. So they create this atmosphere of being like, oh okay, I think you guys are going to make my situation better, which, as you said, that's the role that you have, to treat a patient's symptoms. So that expectation is already then put on the doctor to say, okay, when the doctor comes to see me, I am going to get the answers to this pain or these other symptoms that I'm experiencing. And when the doctor is like, yeah, I think you'll be fine if you take these medications or whatever other procedure the doctor gives to deal with the situation. And so there is that, like, oh, okay, if I do this, then I'll be better. And after that, it's like, once the symptoms go away, there's this feeling of like, okay, I'm done. I don't have to deal with it. Um, and then no records are kept. Like, I don't remember the medication I was taking, whatever the medication the doctor gave me, it worked. So that's a tick. I don't need to remember. And usually, some of these medications, the names are pretty long. And if you don't like, yeah, seriously, if you don't like chemistry, you're like, okay, as long as it helped me, then I don't have to think about it in the future, because the job has been done. um and so that's the thing, is that we come to the hospital with our symptoms, and you are the person that helps to take them away, and we become better people. So I guess we're not really thinking from a personal responsibility aspect, like, it is my health. Why is this happening? What have I been doing to contribute to this illness or this situation that I'm in now? So that doesn't really come up, to be honest. So
I mean, it's just very I don't know. I feel like it's a very basic thing, but people just
mm,
don't tend to think about it because it's the same thing as, you know, are you taking care of your health? Are you exercising, eating healthy, um, sleeping well, doing these things that to the best of your ability can help your health? I understand there's certain things in medicine that you don't have control over, and that even if you do everything right,
mm-hmm,
there's certain things that unfortunately the human body is just the human body, and you might still get sick. But as long as you've been doing your part, it
mm,
actually shows. Like,
mm,
I just feel like patients don't do that here. Like, it's like you want to go to be patched up, but the most important thing is preventative medicine.
mm,
Can you prevent yourself from getting to the point of needing to be patched up? Because, as you said, those medications with long names, they have side effects,
mm,
whether you like it or not. So you
mm,
come to us, we can treat you, but are you ready to deal with the consequences as well? Some like there's a lot that people don't tend to think about, and so ultimately speaking, like the more in control of your own health you are, the more important it's the better it is for you.
mm-hmm,
It's and That's part of the reason why I like preventative medicine, integrative medicine, and all that. Simply because it's so important to do your best to prevent yourself from getting to the point that you actually need these medications as much as possible. Take
mm-hmm,
control over your own health. Because, I mean, ultimately speaking, the physicians, I mean, when a patient is not agreeing with me on something, or they are being stubborn and they don't want to they don't want to start their dialysis, or they don't want to do XYZ, sometimes, they feel like, I'm going to be stubborn, and I'm going to annoy the doctor and stuff. I do not care.
Mm.
One bit. Zero care is given because it's not my body, it's your
Mm.
body. So if you
Yeah.
want to refuse X, Y, and Z, go ahead. You're
Mm.
the one who's going to suffer. It's not me. And people sometimes don't realize that. Like for me, I'm like, oh, you don't want that? That's absolutely fine.
Mm.
You can deal with the consequences later. So, yeah.
Yeah.
Um, I mean, I don't think they realize that. But, anyways, that's the first one I wanted to talk about. The
Wow. Good
second one I
one.
want to talk about that is controversial, but it pisses me off
Oh,
to my core
okay.
is that we are not your therapists.
Mm.
Doctors are not your therapists. And I'm going
Mm.
to say it one more time. Doctors are not your therapists. People have this, it's so irritating when you come to the physician and you're trying to say your whole entire life story. No offense, but I don't care about your life story. I don't
Mm.
have the time to care about your life story. The way the system is built, there are not enough physicians in this country. There are not enough physicians in the world, period. So when you
Mm.
come in and you have a certain set of symptoms, when I ask you to please explain to me, okay, what's going on, what's happening, stick to the prompt, stick to the story. Don't start, so 10 years ago, and then they start saying a story that has nothing to do with why they came in, and then
Mm.
interspersed in between the story is why they came in. Like, no, no,
Mhm.
no, cut it short and get to the point. Because do you
Mm.
really think I'm going to remember the whole story? The problem
Mm.
is also we have time spans. Doctors, like, we're human, right? We have
Mhm.
our attention spans also start cutting short. So when you start those stories, I can guarantee you my mind drifts off somewhere else. And then I miss the point of the story
Mm.
because I just asked you a simple question, give me a simple answer. Now,
Mm.
if there's a backstory to I noticed these symptoms X and Y years ago, that's fine. You can tell me it, but keep it to the point. Don't start talking about this, that, XYZ. It's because I feel like sometimes patients come in and they just want to have someone to talk to. So it's like that interaction. So they start just saying all these things. Or you have patients who come in and they'll like complain about interspersed in their story, they'll be like, yeah, in this nursing home, the care is so horrible over there. Or I had this experience in this hospital, or this and this and that. And I'm just like, okay, fine. Your care in the nursing home was bad. I'm sorry. I personally I don't really care because that's not really my issue.
Mhm.
My issue is I need to treat you. Now, granted, no one should have a bad nursing home stay. I get it. The human part of me obviously doesn't want that for you. But I don't have time to think about that. That's nothing to do with me. Just tell me what are your symptoms, what's bothering you, and keep it to the point. But they want you to listen down and listen to their whole life stories. And I always wondered, why is that? And then if you try to redirect a patient, some of them get mad. And I'm just like, and you know what I've realized is that sometimes when people say that doctors have bad bedside manners, I do agree. There are some doctors who have bad bedside manner. That's a fact.
Mm.
But there's also some who have a bad bedside manner because they've had to learn how to cut people off. It's like, I don't have time for you to be like, say, 10 years ago, oh, when I was a baby. No. They'll be like, no, I asked you about your chest pain. Let's go back to the chest pain. And then you might feel like that's rude, but do you realize that there's so many other patients we have to see? And if you start wasting our time, it affects your care because we have less time to one, deal with your actual issues because you're talking about nonsense. Two, it also affects the care of other patients because you're wasting my time.
Mm.
And some of them just, and I realize some of them just want to talk. And I realize in the Western world, there's this epidemic of loneliness that people don't realize. And
Mm.
so when they come to the physician, it's as if they have a hearing ear.
Mhm.
And so they really want to talk to the physician. And
Mm.
it's like, it becomes like, oh, I just need to talk to them. I just really really need, like, there's someone who can hear me out. And
Mm-hmm.
it's like, no, 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 no. That's what you do with a therapist, not your
Mm,
physician. I feel like the only physicians who actually have the most amount of time to technically talk with a patient tend to be psychiatrists, because they
mm,
tend to deal with things with the mind and stuff. So they really, a lot of times, have to sit down and talk with you. But the rest of us, it's like, hello, we don't have time for this.
mm,
It's just, unfortunately, how the system works. So
yeah.
get to the point, move on, and stop trying to give me your whole entire life story. It's, and it's because it's honest, honestly affects the care you can give patients, because they're wasting so much of your time, whereas that time could be spent with you chart reviewing and trying to figure out, I think this is what's actually ailing the patient, so let me do this and that, or let me get this, images, these labs. But I can't do that if half of my time is wasted with you chatting away and then getting offended if I cut you off. And it's something
Mm,
I'm actually starting to do, is cut people off, because I'm like, sorry, I don't have time to hear your life story. And I don't care about your life story. I care about
mm,
you as a person, and I want the best for all my patients. But
mm-hmm.
I don't need to know your life story.
Mm.
Talk to a therapist if you need someone to talk to.
Wow.
That's it.
Wow. Yeah, you seem very, as you said, frustrated. You sound frustrated about this whole experience because it's probably happening over and over and over again. And I like what you said about it's about the system and how it's set up, because how many patients are you supposed to see in a day? Or on average, how many patients do you see in a day?
Okay. So it depends on how busy the day is. For, like, at least as a hospitalist, I'd say on average is at least 16. And it might not be sound like much, but when you're taking care of 16 sick patients, have to talk to 16 sick patients' families.
Yes.
You have
Yeah.
to do all that because the families can have a lot of questions. They're another group of people who also use you as your therapy, because they start, oh my goodness, this happened and this and that, and oh my goodness, they talk about nonsense that I'm just like, stick to the prompt.
Yeah.
Stick to
No.
what's actually
Yeah.
bothering. So you just don't have time the whole entire day.
Exactly.
And then in between all that, you're being texted by the nurse, I need X, Y, and Z. So and so's blood pressure is low. So and so heart rate is high. This needs to happen. So and so is had a fall. So and so is
Mm-hmm.
having a seizure. So and so so much is happening that is requiring your time and your concentration,
Mm-hmm.
that you don't have all the time to sit down and be like, so
Mm-hmm.
tell me, how was your day? Like, I'm sorry, I don't have time to do that. I
Yeah.
wouldn't mind doing that if I had the time,
Yeah. No,
but
that
I don't.
and that does make sense, right? Because you just said 16 patients. To me, when you say that, that is a lot, because the amount of time you're spending in the hospital is 12 hours. So
Hmm.
imagine if each patient gave you their life story for an hour. So that's already 16 hours for 16 patients. So the math is not mathing.
Hmm.
And and you still have to, as you said, you still have to think through um, the situation, the symptoms, and what that patient might need, and then document that, and
Hmm.
still connect with the nurses and as you said, the families, communicating the results to the families as well. So it's it's just the hours are not adding up, and it I'm just sort of thinking from the patient standpoint. So let me put myself in that situation. When I walk into the hospital, and as I mentioned, I'm greeted by the nurse who's very loving and kind and sweet. And is making me feel comfortable that, everything will be fine. It's okay. That once the doctor sees you, you get to know what's going on, and you be home, in no time. And so we don't see what's going on in the background,
Mm-hmm.
and it's just, yeah, it's quiet in the waiting room. And usually medical teams usually would say, just wait, just be patient. And they'll say, oh, do you want some tea? If the facilities is provides those services, they'll say, do you want some tea? Or just relax, we'll let you know when we know more. And so, not knowing that there is so much going on in the background, it's like there's so many chefs in the kitchen. I'm just picturing like that level of, I don't, not necessarily chaos, just busyness,
Mm-hmm.
that you are experiencing. And you have to get out of that situation or come out to the waiting room and present the results to the family, and still become as if you did not have to deal with 15 other patients, um, that and maybe one of your other patients is in a very serious condition that you have to attend to in like 2 more minutes, because as you said, you get texts. I don't know if you have a beeper or something to say you need to report to your other patient. So we don't see that part, and it just is like we think that we are very special, and we are special, but we're not special, right? I've something I've come to learn. And so there's also that, honestly, there's that part of vulnerability coming out, where for some reason, when, at least for me, when I go to a doctor, like, I don't like being in a hospital. I
Mm-hmm.
question myself, like, why am I here? What could I have done better? So I'm that preventative medicine type of patient. Um,
Mm-hmm.
but when I do end up in the hospital because I have symptoms that I have to deal with, and I've tried everything I could at home and it's not working, there is that fear I have around, like, death, for example. Like, there's almost this idea that I have no control. Like, I don't know why my body's is behaving the way it is, and I have just no control over it. And for some reason, that reality of death comes in. And I'm not saying that I'm thinking of dying, but that idea
Mm-hmm.
of like, oh wow, yeah, I am really scared. What's going on? And I'm just waiting for the doctor to come and tell me the results, or like, so I'm so vulnerable that, in a way, I want someone to just say, it's going to be okay. It's going to be all right. And the other thing is that, as a patient, I'm trying to seem like I'm a good person. Like, no, this honestly, doc, this wasn't my fault. And like, I like, kind of like being like, no, this was really not really my fault. So you see, what had happened was, and it's so funny because when the nurses make me fill out the forms where you say, how many glasses of wine or like alcohol did you take this week? And I'm just like, oh no, in my head I'm like, I think I did 2.5. And so then, if the option is like, there's an option for 2 versus 3, like, I feel like I want to impress my doctor and be like, no, 2, it was 2. It's more 2 than 3 glasses. So I'll put 2 because I want to seem like a good person. Like, I really do take care of myself. It's not me. Um, and so, admitting fault, as you said, taking responsibility just seems very hard in that moment. But from what you are experiencing, or from what you're saying, I feel a lot more like responsible now to say, okay, I should, like, yeah, take on. It seems like there's a need to take on more personal responsibility, even with that vulnerability aspect. But I'm sure you also understand that patients are also just being very scared and don't know their future when they come to the hospital.
I mean, I get it. You're vulnerable in the hospital. That's why it's important for us to be nice to you, like understanding and nice to you. But again, understanding and nice does not mean you talking about everything and using
Mm.
us for therapy. It does not mean that. Um,
Mm.
you know, and sometimes, when this is me digressing a little bit, but when patients, they panic about, okay, what's happening? What are my results? The doctor
Mhm.
hasn't said anything. It's been an hour, 2 hours. And then you get this like stat text from the nurse saying, hey, patient's family really wants to speak to you. And I get it. And like they're panicking. They're trying to figure out what's happening. And like text back usually and I'll be like, yep, I will talk to them as soon as I can. An hour goes by, I haven't had time to talk to them because I'm running around like a chicken with his head cut off. And then
Mm.
I'm like, and the nurse is like, they're really getting irritated. They want to speak to you. And I tell the nurse, I'm held up at the moment with more important things. I can't talk to them right now about results. Like they just have to wait.
Mm.
And it's uh it's a thing in which I guess they don't realize, this ties into my third point that
Mm.
doctors are not superhuman.
Mm.
We're not superhuman. We're not perfect. And why does this tie into the fact you really want to talk, like you really want the results right now. And granted, I have to, triage my patients and triage what's important.
What
So,
is triage?
so basically, it's trying to figure out what's the most important thing first and dealing with the most important and urgent things first, and then dealing with the
Mm.
other ones, the less important things later. So if
Okay.
you really want to talk to me because of your results, if I haven't talked to you, if I have looked at the results and my first impression was not to talk to you, that means your results are probably not that urgent. Or they're not deadly. They're not going to kill you right now.
Mm.
So I don't
Okay.
need you. I don't need to talk to you now because it's not urgent. If the results came back and you had a huge brain bleed, oh hell yes, I would be up there to talk to you about the results. But if the
Mhm.
results are not that urgent, they don't need to be dealt with now. Maybe that's why I didn't talk to you initially. Again, I really like what you said is that patients don't see what's happening in the background. So you don't
Mhm.
understand why the doctor is taking forever to come to talk to you. You don't really understand that there's so many other things going on. Like I'm not superhuman. I'm one person and I have to
Mhm.
juggle all these things. So that means someone's gonna have to wait. And
Mhm.
so the least important stuff is going to have to wait. And I feel like sometimes patients a lot of times they don't understand that. And I literally, if they get mad, I tell them I had other more pressing, important things to do. Like, because the thing is that when patients come in, you're thinking about me, myself, and I.
Mm.
Like, and that's the same thing for families. They're so concerned about their loved one, which makes sense, right? The
Yeah.
problem is, so when they want, so they always want to be updated. And when they call and they'll be like, I've had family members who call like 4 or 5 times. They call the nursing station and they're really wondering why I haven't talked to them. Whereas that whole entire day, I've been stuck in a patient who's been trying to code. Code means the heart rate stops or their respiratory rate stops. I've been stuck in the room all
Mm.
day. I haven't had time to talk to these people because I have a patient who's trying to die and I'm trying to prevent them from dying.
Mm.
But people don't.
Mhm.
I wish people understand if the physician is not calling you back immediately, there's a reason why.
Mm.
Like, unfortunately, I always say, when you're in the hospital, you're on my turf, not your turf. You're on my turf.
Mm.
And things are going to happen the way I want them to happen because I'm the one
Mhm.
who's running the ship, who's steering the ship. So I'm the one who knows what I have to deal with. So if me talking to you right now is not urgent, deal with it. That's why I don't talk to patients' families in the mornings unless I'm discharging the patient or something urgent comes up and I need to talk to you. you better be. So if I call you and the patient is not being discharged, oh, you better know something. It's about I'm about to tell you something really bad because that's
Mm.
that's the only time I'll call you in the morning and I'll be like, I need a decision right now because X, Y, and Z is happening. So if I don't call you in the morning, it's a good sign that the patient is relatively stable and nothing is going to kill them right now. But
Mm.
because I have to like organize my day because I'm just one person.
Yeah.
So that means, I have to make sure the most important things are done first. And it goes on like that. In the same way, the same vein is we're not perfect. So we don't have all the answers. Because
Mm-hmm.
sometimes people get shocked when as a physician you don't have an answer for something. And I'm like, we have a lot of answers, but we don't have all the answers.
Right. Yeah.
And so it's just all about, we're just we so we're not perfect.
Mm-hmm.
We get tired. We can't just work like robots all the time.
Mm-hmm.
We need to eat. We need to sleep. So
Mm-hmm.
when you're thinking about, oh, this the physician just keep going, keep going, keep going, like you have to realize they're human because you want a physician who's well rested to take care of you. Because if they're not well rested and not taken care of,
Mm-hmm.
things are going to be missed, and then it's going to end up affecting you. So yeah, people just need to realize that.
Yeah. Yeah. No, it sounds like patient attitude is very important as well. Because as you said, you're not
Mhm.
superhuman. So if you're not superhuman, you're just human. And so you're
Mhm.
having to deal with interacting with patients just like any other person. And so if your interactions, I'm sure, are not as pleasant with that particular patient, it's also probably harder for you to provide that service, or at least go above and beyond. You probably will still provide the basic service because that's your duty for you to treat a patient, but you may not have a desire to go above and beyond to serve that patient if you feel this resistance, this attitude of why are you not serving me, why are you not telling me more, or if a patient is not satisfied with the answers you have provided, or they feel like you should
Right.
have done more than what you have done. Um i i can only imagine, like, yeah, like you also get affected by the way you're treated by the patients.
That's funny because I didn't even mention anything about that, but that's true. It's part of the whole. You're not superhuman. Like you do get affected by these things. So if you're an annoying patient, by annoying it could mean a lot of things. Maybe you're
It
just
can mean
rude.
that thing. Yeah.
Maybe you'll just talk too much and I cannot handle. It just wastes my time.
Mm-hmm.
Or you have a really annoying family or something like that. You will find you'll be the last person I see because I cannot waste my time. I have to like I realize okay, I have to avoid this person as much as possible. So I'll
Mm-hmm.
see everyone else first, and then you'll be the last one I see. Like I don't know, whenever I finish rounding.
Mm-hmm.
And yeah, I mean, you might think you'd be seen earlier in the morning, but like no, or but you're not gonna be seen early in the morning, or you might find that some physicians will just spend 2 minutes with you and they leave. They don't like they will just walk in, walk out, so because they don't want to
Mm.
spend more time with you because you're annoying, and that just goes hand in hand with we're not superhuman. We also get affected by these things. We have emotions, so
Mm-hmm.
um, it's important. Like what you said was spot on, in the sense that if you're actually nicer to us, you can bet and believe we will go above and beyond to like
Mm.
try and help you. But if you're an asshole, we will try and get you out with the minimum possible. We'll just be like, okay. Can leave. Bye. Bye.
Mm, yeah. Yeah, that I can see that. I mean, I've read articles and listened to podcasts, or just learning more about the attitude. Even I believe patients, and maybe you've seen this in your own experience, that patients who are positive about their, just towards their doctor, or even just about what they're going through, like they accept their illness, maybe they even accept their responsibility, and some of them might even be spiritual. They tend to actually do well, or recover faster or better than patients that have this negative energy and are
Hmm.
blaming everyone and things like that. So I don't know. So there's some science, proven science around that, but so interesting, very interesting.
Right?
Anything else? I'm just like, I'm learning. I'm like, okay, how can I, in my mind, I'm like, how can I be a better patient even before I go to a doctor? Seriously.
Just to finish up with what I said, I didn't specify it. When I said we don't have all the answers and we don't know everything, there's different specialties in medicine, and there's a reason why they're different specialties. So for those of you who ask me something that has nothing to do with my specialty, and I tell you, unfortunately, I don't know, you have to ask the surgeon. Don't like look at me like, but you're a doctor. Like, I didn't study everything in medicine. I studied something more particular. So there's different specialties in medicine. So people have different levels of expertise. So, and this also goes to like when you have family members or anyone who try to get you to diagnose them. And it's like, if this is not my specialty and I don't know anything about it, sorry.
Mm,
But
yeah.
I think a fun one, not a fun one. Well, actually, it's a fun one. Doctors are not one dimensional.
Mm,
And this can go in a lot of different ways. Okay? So let's talk about this. I remember a couple years back, there was this whole issue about this female physician who I think was her credentials on Instagram. It was very obvious that she's a physician. But then she posted pictures of
mm-hmm,
herself in a bikini in on a vacation. And there was a
mm,
lot of uproar from I think male physicians and then just patients in general who were like, why is she posting like pictures of bikinis on Instagram? I think the problem is because maybe some of her workmates or something, some people were friends with her and they saw that. And there's this whole uproar. And in my head, I was just like, and then there's this whole uproar now in the female physician community, because they were like, "What is wrong with
mm-hmm,
her posting a picture in a bikini?" What do you think? I think when they think about physicians, people think about very boring people who are
mm,
very conservative, who cover themselves
yeah.
from head to toe, who don't have lives outside of the hospital, who or their whole entire life is just medicine treating people. They have to be very, they wear their hair back or they look like this, they look like that. And so when you see a female physician who's young, maybe has tattoos, wearing a
Mm-hmm,
bikini, doing this, and it becomes an uproar. This is a human being. Like, I'm a physician, yes, but that's not only what I am. There are other things I do. Like, for
mm,
example, like for me, now I can say I'm a physician, yes, but I'm a podcaster. Yeah, I love podcasting. I'm a traveler. Yes, I love traveling and all the other things that I
mm,
do. It's just not, being a physician is not my entire identity. It's part of my identity, but it's not my entire identity. But people really, I feel like people feel safe with this version of a physician being very conservative, very straight, and very everything. Like, I feel like that's people's safe
mm,
space because I don't know, for some reason, they feel like they trust someone more because of that.
yeah.
And in my head, I'm just like, no, physicians have lives outside of the hospital. Like, And they're
Mm-hmm.
not only just physicians, they do other things as well. So people need to get this thing out of their head that physicians are only supposed to look like X, Y, and Z or do X, Y, and Z. Like if you find out that your physician goes clubbing and is whining in the club and stuff like that, I can guarantee you someone will it will reduce their ratings, because a lot of
Mm,
patients will be like, oh my
yeah.
goodness, I can't trust this person. But it might have nothing to do with their intelligence and their ability as a physician. They just outside of the
Right.
club, outside of the hospital, they just want to go and want to go clubbing. What's the problem with that?
Mm-hmm.
There's no problem with that. Like if people, I feel like if people see what happens in medical school, in residency, when they see what happens behind the scenes, then they'll realize, they'll be like, wait a minute, these are my physicians. These are the people who are
Yeah.
treating me. Because I think I remember one of my friend's husbands being like, he doesn't want to come to the hospital now that he hears all our stories and he sees how we do things and he sees all
Mm-hmm.
this stuff. He realizes, what, like your vision of what a physician is or should be like, totally different
Mm-hmm.
from the reality. It's the same thing when it
Mm,
comes to the whole one-dimensional thing. Is, I think I remember telling you earlier during the week, last week, that my 94-year-old patient, she keeps on confusing me for the nurse, which I'm used to it. And then when
mm-hmm.
she figured out I'm the physician, she's like, "Oh, you're my physician." She's like, "You don't look like a physician." And that's the one I told you. I asked her, "So what does a physician look like?" And I get she
Mm,
paused and she had to think about the answer. And then she was like, "Oh, they're usually a little bit more stern, and they like no more stern and more not soft spoken. What's the opposite of soft spoken? Like assertive and things like that." Like after she
assertive. Yeah.
paused, and I was like,
Mm,
I'm definitely challenging her version of a physician, because I'm a young black female. Clearly, I look young because people think I'm a baby. They're like, "How old are you?" I get that question all the time, and it's like,
mm,
so in their head they're like, "Wait a minute, this is my physician." Physicians come in all shapes, colors, sizes, religion, whatever. They come in all of that. They can wear
mm-hmm.
tattoos. They can have piercings. It does
Yeah.
not reduce the credibility of a physician. Like,
Yeah.
I don't know.
Yeah.
That's
Wow.
just, yeah.
No, that's true. I can see that. Because you know how even when I was younger, just as a child, when people say, "Oh, you're gonna grow up and become a doctor," like this idea of that's the one career that represents, um, like you're doing something good in the world and you're saving lives and you're
Hmm.
smart, and there's just this thing of like you're going to be somebody. Like if you're a doctor, you're a quote unquote somebody. um and as you rightly put it, um being a doctor and the skills that you have is a representation of your ability to to learn, like your intelligence, and you're using your
Hmm.
intelligence to learn about the body and about how you can treat the body if it gets sick and things like that. And so um for some reason, because maybe intelligence is such a admired trait in people, and people want to associate it with other things like being a good person. That means, as you said, maybe even conservative. And there's this savior complex that you are associated with because you save lives. That means you're a good
Hmm.
person. But they're not thinking that you save lives because you have this skill to understand what's causing that illness, to the
Hmm.
ability that you can. As you said, you don't have all the answers. So, and from what you're saying is that it sounds like society has, without even asking you or all the other doctors in the world, whether you want to be a role model based on what society is considering a role model. So,
Hmm.
you, for example, yourself, You're walking in the hospital, minding your own business, and someone is looking at you and being like, wow, that's a doctor. Like, I can't believe she's a doctor. And you're just human. Like, you're just human. You chose to do a medical degree. You could have done something else with your life. um, but somehow they have put all of these expectations. And I'm sure, I don't know if people even go ahead and ask you, like you said, your age, are you married? People like feel like because they've put you on this pedestal, they feel like now they are, in a space with someone amazing. Like, obviously you're amazing, but like they now think like, oh my goodness, this is the doctor. Like, I want to know more about this doctor. Like, how did she do it? How did she become a doctor? Because that's what I would think. And things like that. Is she single? Is she like this? Which church does she go to? Is she Christian? Like, every people just want to know. And you didn't ask for that, but society has pushed that on you. So I can see that. Um, yeah, I can see that. And I can see on the other end the disappointment if, as you said, you go on Instagram and you're just living your own life because that's what you enjoy in your personal life, whatever you're doing. And they're thinking, oh, maybe they're expecting you to have this picture perfect family and all of this. And, you're just, I don't know, baking a cake, sit it at home. No, shout out to all those people who bake cakes and sit at home. But if you get what I'm saying, is like they're expecting you to have this, as you said, conservative, righteous, sort of kind of life because you save, quote unquote, save lives.
Yeah, it's I find it very frustrating because I think I'm very much a creative person.
Mm,
Um, like I might like sciences and all that jazz, but I'm also a very creative person.
yeah.
Um, and for me, I would love to go into the hospital wearing with a pink bow, tying my hair with a pink bow,
Ooh, yeah.
pink nails, pink.
Oh.
I would totally not mind doing that. Or like, like sometimes like some of my headbands have like kind of look like a bunny ears. They're not really bunny ears, but
Mm,
like it goes up. Like things like that. It's just my creative nature coming into play.
mm-hmm.
But I can't do that because it makes you look less professional or less
Credible.
credible. And I understand that this exists in all different fields.
Mm-hmm.
Um, I understand it also exists in a lot of other fields. It frustrates me because I feel like you can't let out your creative side in some of these fields. Like some of these fields, it's so like as a physician, it's so hard to do that because they expect you to look a certain way, act a certain way. So it becomes a whole, and then if you don't, it's like you kind of lose credibility. Because an example for that is I think patients respond better, not necessarily respond better. They might have a higher chance of saying you're a physician if you're wearing professional attire than if you're wearing scrubs. So they
Mm,
really are trying to like ask the physicians, can you please wear professional attire, not scrubs?
mm,
Because it looks, I guess this exists in a lot of different places. But in my head, I guess I'm one of those people who's always like challenging the norm.
yeah.
Like, don't just assume based off how I look. Like, I understand that first impressions and all that matter.
Mm-hmm.
But the problem with those is they're largely guided by our biases. And so that's where the problem comes into play. It's because of your biases. So if the thing should be just don't assume initially and just ask and go along with it.
Mm-hmm.
Because the whole thing about dressing up, like, I'm not going to lie, it's not bad. But I just want to throw on my scrubs. And yes, they are cute scrubs because at
Yeah.
least now we have nice, cute looking scrubs and
Ooh.
go because I'm trying to be as comfortable as possible. I mean, I have to take care of all these patients.
Mm-hmm.
I have to go into COVID rooms. I have to do this. Like, I'm not trying to wear my nice, cute outfit to the hospital
Mm.
where you can get germs on it. And all the what have you on it. Like,
Mhm.
no, thank you. But
Mhm.
yeah, I get so irritated with the whole one dimensional thing. Like, you have to think like this, act like this, dress like this, look like this. I'm like, no.
Mm.
Anyways, the last one I'm going to end with is going to be doctors are not necessarily rich.
Ooh. Ooh.
So
This is a good one. I want to learn more.
I understand, at least in America, that doctors are among the highest income earners.
Mhm.
But there's a lot of different aspect ways you can look at this. One, we don't get trained in medical school in regards to financial literacy.
Mm.
So you find that a lot of physicians, when they start making money, their lifestyle creeps up. You know, the
Mm.
lifestyle creep, and then they essentially they're still living paycheck to paycheck, but at a higher budget.
Yeah, I
Uh,
see what you're saying. Yeah.
so you think they're like, oh, they're so wealthy, they have all this, they have all that, but they're still living paycheck to paycheck. What are the investments? What else is there? I mean, people just assume automatically that, oh, you guys have a lot of money. True, they do make much more money than a lot of other people,
Mhm.
but it doesn't mean that they're actually, saving or investing more. It depends. Like, we have the capability to do more for sure,
Mhm.
but it just
Yeah.
depends on how financial literate you are. Because there have been a
Mm.
lot of physicians who have made not the best choices. But here's the other thing. Yes, you make a lot of money, but the government also loves to tax you a lot.
Mm.
Like,
Yeah.
losing 35% of your income in money, that's a lot of money. Like, I have to work hard and then I have to lose 35% in taxes.
Mm.
Like, why?
Yeah.
Like, why? So when you're thinking about, oh, they're earning a lot of money, well, they're also getting taxed a lot of money.
Mm.
And another thing is, like, you have to think about return of investment from a time standpoint. So,
Mm.
yeah, physicians might earn a lot of money, but how much time do they put into that to get that money?
True. Yeah.
Like, it's a lot. Being a physician is a high stress job. So that's why it also pays well, because there's a lot of stress, a lot of demand on it.
Mhm.
So
Yeah.
that's return of, the return on your investment in regards to time. You're spending a lot of time to get this money. So it's like people thinking about it like that. Yes, I'm not going to deny that they are high income earners, but it's just there's just more to it than meets the eye.
Mhm.
And I think people just um, they don't tend to think about it deeper. They just approach it from a more surface level kind of thing.
Right.
Um, but yeah, I mean, doctors definitely can be rich. And yes, I know someone's going to be like, well, they earn a lot of money. Well, yeah, but
Mhm.
there's a lot more to it.
Yeah. And the other thing that I don't think you mentioned this debt that has to probably be paid off if you got loans while you're a
Yeah, I
student.
forgot about that. I totally
Yeah.
forgot about that. Yeah, they also have a lot of high like debt burden.
Mm. Yeah. And I know I can understand that, right? Um Even for example, what else are you missing out because you're one in the hospital for so long, because your hours are, for example, 12 hours
Hmm.
in a day, and experiences with friends. For whatever reason, the way I operate, I feel like I am like a doctor's best friend. So I'm able to, like, do my own thing. And then when my doctors, my friends who are doctors have the time to chill and relax, I'm your girl. Like, I'm the person that's like, yeah, let's chill. Like, I don't feel like I miss a bit with, like for example, with you, like I know we don't speak every week, but then when we meet up, we catch up and then we keep going. Like, I'm good. I'm good. Shout out to all the doctors there. I'm your girl. Um, so I don't need to see you every day, or we don't need to talk every day. It's fine. We can work things out. But I'm sure that for some people, maybe who are not wired like the way I'm wired, you're missing out on, maybe, if you have family of kids, you don't get to see your kids, um you know every day, or like by the time you get home they're already in bed. um and then you still have your extended family, and you can't really, be in close communication with them all the time, like the way other people in other professions have.
Mhm.
um, so there's a bit of that sort of quality time that you're already missing out, and didn't it didn't start with work. It started when you decided to pursue your medical degree. Because I
Medicine.
remember,
Mhm.
yeah, I just because I clearly, like, if you look at if you compare with me as well, like, I've a lot of things have happened over the number of years you have been just studying. um, changing jobs, moving places, moving continents. There's just been so much, and it's just the nature of the choice, that you made. But yeah, I there's a lot more. I can see that. I can see that. So,
Well,
wow.
that's all I had.
Oh wow, no, it was good. It was really good because um I hope this helps our listeners to understand what it means to be a doctor, and what it is not. Um and if you are on trying to become a doctor, let this not scare you and say, oh, I'm not going to become a doctor. But at least we're trying to give you um an inside look from a practicing physician. And if you're on the other end as a patient, you get to get a taste of what's happening, quote unquote, in the background, as you are seated there waiting
Mhm.
for your doctor to show up and tell you your results, or like what's going to happen next. Um, and so there's, just something to be aware of. But I do want to say, from not being a doctor, I think it's still incredible what you do. Um, and you do have an amazing skill set that is obviously helping people every single day. And I don't know if your patients tell you thank you, but just from what you're saying, I have much respect to you for doing what you do on a daily basis.
Oh,
I think it's a
thanks, Joey. Thanks,
yeah.
Joey. Just me shouting out to myself. I got the highest patient satisfaction out of all my colleagues. So
Ooh,
I was like, oh,
yes,
the highest patient
amazing.
satisfaction and the most complex patient out of all my colleagues somehow.
Congratulations.
So
Yes, yes, we are winning out here. Amazing. You deserve it. You deserve it. And it clearly shows from how you've been speaking that you do care, but you also do realize that there are ways we can help you be a better physician, or at least provide more care to your patients
mhm.
rather. So thank you for sharing. So this is the end of the first episode of the career series. look out for the next episode, which will be, guess
Hmm.
what? It's gonna be
Drum roll.
what engineers are not. So that would be me in the hot seat. And I look forward to it. And this is gonna happen every other 3 episodes. So we would just keep, again, sharing our tips and our insights on our professions, and hopefully it's something that will add value to you in your life. So until next time, have fun, live large, and don't be afraid to be an outlier.
Thanks, guys. Have a good one.
Thank you. Thank you, guys.